Infanticide. Unlawful destruction of a child below the age of 1 year is known as infanticide. Only the mother can be charged with the offence. The reason being, the mother may be suffering from disease of mind due to the effect of stress associated with her pregnancy, delivery, puerperium, or lactation. In India, there is no distinction between the murder of newborn infant and that of any other individual. If a fetus is killed at any point prior to birth, it is known as feticide. Whereas, if a newly born child before the age of 1 month is killed unlawfully, it is known as neonaticide. When a baby is found dead at autopsy, other than the routine findings, the following points need to be ascertained: whether the child was stillborn or dead-born, whether the child had attained viability, whether the child was live-born. If born alive, how long did the baby survive? What was the cause of death? Stillborn baby. A baby was alive in the uterus but dies during the process of birth, which is born after 28 weeks of gestation and did not breathe or show any signs of life after being completely born, is known as a stillborn baby. It is commonly seen in a primipara with an illegitimate child and a premature delivery. It has an incidence of about 5% of the births. The common causes of stillbirth are prematurity, birth trauma, placental abnormality, toxemia of pregnancy, congenital defects, erythroblastosis fetalis. The baby is born in a sterile condition and hence the putrefaction occurs outside inwards. That is, as there is no bacterial flora in a fetus, the putrefaction commences first externally and moves inwards, unlike in adults or respired babies where the first sign of putrefaction is seen in the cecum. Dead-born baby. A dead-born child is one which has died in utero and shows one of the following signs after it is completely born: rigor mortis, maceration, mummification. Rigor mortis at delivery. Rigor mortis is seen in a fetus dead in uterus. Maceration. It is an aseptic autolysis of a child dead in the uterus for more than 3 to 4 days and is surrounded by liquor amni, but with exclusion of air. If air enters the liquor amni, then petrification sets in as microorganisms gain entry along with the air. Maceration is not seen if the baby is born within 12 to 24 hours after death. Signs of maceration. Skin slippage. It is one of the earliest signs of maceration seen within 12 to 24 hours of death. The body is soft and flaccid and becomes flat when laid on a level surface. Emits a sweet but disagreeable odor. Skin is copper red to copper brown color. Joints have abnormal mobility. Bones are flexible and get easily detached. Large blebs are seen with red serous or serosanguinous fluid. Viscera are soft and edematous, and the serous cavities contain red turbid fluid. Spalding's sign. On radiography, there is overriding of cranial vault bones seen after 1 to 2 weeks due to shrinkage of the brain tissue. Mummification. It occurs when the fetus dies due to deficient blood supply and when liquor amni is scant with exclusion of air. Viability. The physical ability of a fetus of more than 28 weeks of gestation to lead a separate existence independent of the mother by virtue of certain degree of development after being completely born. It could be assessed by measuring the crown heel length of the fetus, and if the length is less than 25 centimeters, then the square root of the length gives the period of gestation in lunar months. If the length is more than 25 centimeters, then the length is divided by 5, which also gives the period of gestation in lunar months. The presence of an ossification center in the talus indicates that the age of the fetus is more than 7 months of intrauterine life. Live-born baby. A baby showing any sign of life after being completely born is called a live-born baby. According to law, a dead fetus is born dead until the contrary is proved. In civil cases, any sign like a movement or twitching or crying of the baby is accepted as live birth. But in criminal cases, the signs of live birth need to be demonstrated at autopsy. Signs of live birth. Post-mortem examination may provide a strong but not a definite evidence of live birth. The various signs that indicate live birth are as follows. Shape of chest. It is flat in case of an unrespired baby, whereas it is barrel-shaped in a live-born baby. Position of the diaphragm. It will be at the level of 4th or 5th rib in an unrespired baby, but when the baby respires, it moves down to the level 6th or 7th rib due to expansion of the lungs. Condition of the lungs. Unrespired lungs will have sharp margins and are small. They are dense, firm and non-crepitant, having uniformly reddish-brown to bluish-purple color. The air vesicles are non-inflated and it weighs 1/70th part of the body weight. Respired lungs have rounded margins and they are large, covering the whole of the heart. They are soft, spongy, elastic and crepitant. As the blood gets aerated, the color of the expanded area becomes light red and has a marbled appearance. It weighs 1/35th part of the body weight. Hydrostatic test. It is based on the fact that on breathing, the volume of lungs is increased, which more than compensates the weight of the additional blood, due to which their specific gravity is diminished. A ligature is tied on the bronchi and lungs are separated. Each lung is individually placed in the water. If they float, each lung is cut in 12 to 20 pieces and placed in water. If these pieces float, they are wrapped in a cloth and squeezed by putting a weight to remove the tidal air. The pieces are again placed in water, and if they continue to float, it indicates that respiration has taken place. If the lung sinks at the initial stage, or if the pieces sink on pressure, then respiration has not taken place. If some pieces float and some don't, it indicates feeble respiration. The respired lungs may sink from some diseases like pneumonia or conditions like atelectasis, etc. At the same time, an unrespired may float from putrefactive gases or artificial inflation. Hydrostatic test is not needed when the fetus is not viable or is a monster or a macerated one or shows presence of milk in the stomach. Stomach and intestinal changes. Air is swallowed into the stomach during respiration. This can be tested by Breslau's second life test or stomach bowel test. The stomach and intestines are removed after tying double ligatures at each end. They float in water if respiration has taken place, or otherwise they sink. If milk is present in the stomach, it is a positive evidence of child surviving for some time after birth. Period of survival. Though it is not possible to determine the exact duration of survival of a child with certainty, some indications help in assessing the period of survival in a live-born baby. They are skin changes, meconium passage, blood changes, umbilical cord changes, circulatory changes. Skin changes. The skin of a newborn baby is covered with vernix caseosa. If not washed immediately after birth, it persists for a period of 24 to 48 hours. At birth, the color of the skin in a newborn baby is bright red in color, which gets darker by 3 to 4 days. The skin becomes yellow due to physiological jaundice between 3 to 6 days and finally returns to its original color by 7 to 10 days. Fine desquamation of the skin begins by second day and is completed in 15 days. Meconium passage. Meconium is a green viscid substance consisting of thickened bile and mucus. It is present in large intestines and gets completely excreted by 24 to 48 hours. Blood changes. The nucleated red blood cells in the fetus disappear within 24 hours of birth. The fetal hemoglobin reduces to 80% by birth, whereas it decreases to 7 to 8% by third month. Almost all of the fetal hemoglobin will be replaced by adult hemoglobin in 6 months. Umbilical cord changes. The umbilical cord is ligated or clamped immediately after birth. Blood clot at the cut ends by 2 hours and the umbilical vessels obliterate by 24 hours. The cord shrinks and dries by 12 to 24 hours. This is also seen in stillborn babies, as this process is seen as a result of dehydration. A red zone of inflammation is seen at the base of the cord by 36 to 48 hours. The cord mummifies in 2 to 3 days, and by 5 to 6 days the cord falls off, leaving a raw area. It heals with a scar by 10 to 12 days and cicatrization occurs in about 3 weeks. Circulatory changes. The umbilical vessels, ductus venosus, ductus arteriosus, and foramen ovale, which were necessary to carry out fetal circulation, are no longer needed in the body and hence will obliterate. The umbilical arteries start contracting by 10 hours of birth and completely close by 3 days. The umbilical vein and the ductus venosus close by the 4th day. The ductus arteriosus begin to contract by the 3rd day and is completely obliterated by 10 days. The closure of the foramen ovale usually occurs by the 2nd or 3rd month. Cause of death. Death of a live-born baby can result from natural causes or unnatural causes. Natural causes. There are many natural causes of death in a newborn baby, and the common causes are usually immaturity or low birth weight, malformations that are inconsistent with maintenance of life, maternal diseases like syphilis, neonatal diseases of heart, lungs and brain, neonatal infections, birth trauma, erythroblastosis fetalis, RH incompatibility between the mother and the child. Unnatural causes. The unnatural causes are further categorized into accidental causes and criminal causes. Accidental causes. Accidental deaths may occur as a result of prolonged labor, if the fetus is weak, or due pressure on the head leading to fracture and hemorrhage. Prolapse of the cord. Cord firmly pressed upon by advancing head leading to death from asphyxia. Twisting of the cord or knots in the cord can cause death due to asphyxia. Injuries to the mother due to fall during pregnancy or death of the mother at the time of delivery gives little chance of saving the child. Suffocation. If the child is born with membranes over the head covering the mouth or nostrils, or aspiration of blood, liquor amni or meconium. Precipitate labor. It is a condition where all the 3 stages of labor merge and delivery occurs suddenly without labor pains. It is usually seen in a multipara with large and roomy pelvis with a relatively small child. It usually occurs when the mother feels fullness of the abdomen due to advanced pregnancy and goes to the toilet. The unconscious straining leads to precipitation and delivery of the child in a lavatory pan, leading to suffocation and death. Sometimes, delivery occurs when the mother is in upright position, where the child may fall on the ground and sustain head injuries or may die of hemorrhage due to tearing of the cord. Criminal causes. These may be categorized as acts of commission and acts of omission. Acts of commission. These are done positively to cause the death of an infant. Suffocation, by pressing a pillow or a hand against the face. Strangulation or throttling, sometimes by using the umbilical cord itself. Drowning by immersing the child in a bucket or a tank of water. Blunt head injury by dashing the head against the wall. Fracture dislocation of cervical vertebrae by criminal violence on the neck. Other injuries like stabs, cutthroat, etc. Poisoning, not common. Burning, rare. Acts of omission. The law presumes that a woman is guilty of criminal negligence if she does not take ordinary precautions to save her child after birth. Deaths from omission at birth are more commonly related to failure to provide proper assistance during labor, leading to head injury. Clear air passages leading to suffocation. Tie the cord after it is cut, causing death by hemorrhage. Protect the child from exposure to heat and cold. Supply the child with proper food. Battered baby syndrome. Synonyms: child abuse, Cinderella syndrome, Café's syndrome. A battered child is the one which has sustained repetitive physical injuries due to non-accidental violence by a parent or a guardian. It is commonly seen in male child below the age of 3 years, though it may be seen at any age. Usually, only one child in the family is battered, either the eldest or the youngest. It usually is the unwanted child. Such battering parents come from a low socio-economic status. The classical feature of this syndrome is the discrepancy between the nature of the injuries and the explanation given by the parents, delay in treatment, and presence of injuries at different stages of healing. These injuries often progress from minor to more severe. The factors precipitating battering of a child are either mother with a low IQ or pregnant or herself a battered child. Child is usually crying, refuses to eat, or persistently soils clothing. Findings: a doubt should arise in the mind of the doctor examining such a child as to its abuse. More than often, such children will have varied injuries at different stages of healing on the bodies, like abrasions, contusions and lacerations over the cheeks, mouth and neck and chest. Cigarette burns on the back and buttocks. Infantile whiplash syndrome. Effects of shaking a child vigorously to cause subdural hematoma, intraocular bleeding, and sometimes permanent brain damage. Bite marks may also be seen on different parts of the body. Periosteal hematomas, retinal detachments, subconjunctival hemorrhages. Skeletal injuries like transverse and spiral fractures of long bones, multiple rib fractures. Metaphyseal and epiphyseal fractures of the bones may be seen. Sudden infant death syndrome. Synonyms: cot death, crib death, SIDS. It is the sudden and unexpected death of an apparently healthy child, whose death remains unexplained even after a complete autopsy. SIDS is seen in 0.2% to 0.4% of live births. It is commonly seen in children between the ages of 2 weeks to 2 years, with a marked peak between 2 to 4 months. This is predominantly seen in males with a male-female ratio of 3:2. There is increased risk amongst the members of a twin pair. Death usually occurs during sleep at all times of night, with an increase in the early morning hours. Low socio-economic status of the family and cigarette smoking by pregnant women increases the risk. Various theories have been put forth regarding the probable causes of death in such children. The commonly accepted hypotheses are as follows: prolonged sleep apnea, periodic failure to breathe during sleep, respiratory infection leading to viremia causing further depression of respiratory centers during sleep, nasal edema and mucus secretion narrow the small respiratory passage. Sleeping posture of the baby may cause death positional asphyxia, hypersensitivity to cow's milk, house mite allergy, botulism, neurogenic or anaphylactic shock,